All you have to do is see a poor person who was blind the day before see the look on their face. When you know that that's possible, you think of the people who are blind who don't need to be. It's not hard to be passionate about it.
$50 and 15 minutes can transform someone's life. They go from being blind to being able to see. There's nothing easier, simpler, or more wonderful than that.
We are the people who started Seva Canada. We were in India when we were in our 20s. We got involved in a community program, and that was the eradication of smallpox, which was a WHO program. And in 1975, smallpox was eradicated. When a bunch of us who were working in that program got back to North America, there was a feeling like we shouldn't let this energy die. We should put this energy to good use. And that particularly affected Larry and Girija Brilliant. And Larry in particular took a real leadership role in creating the Seva Foundation, which pulled together people from different walks of life, but who were all motivated by these goals of service.
And one key person was Nicole Grasset. She had an idea that the next big job to tackle was blindness.
So Nicole Grasset first introduced Dr. Venkataswamy to Seva. Dr. Venkataswamy, affectionately known as Dr. V, was a retired Indian eye surgeon. He wanted to service the poor, so he started a hospital in his home, and it was an 11-bed hospital. And his idea was to provide high-quality services to everyone, regardless of whether they could pay or not. And that was how the vision of Aravind Eye Care System and Seva's way of working began.
Dr. V was very single-minded. He was just completely focused. And when he first raised the issue of why can't eye care services be like McDonald's, he meant efficient, consistent, mass-produced, but in the best possible way to reach the most possible people.
Dr. V's model of sustainable eye care has been implemented in every one of Seva's eye care programs, beginning in Nepal.
The first blindness survey in Nepal in the early 80s was actually the very first time that anyone had done a proper study to see what were the causes of blindness. And that study found that the main cause was actually cataract. At the time, everyone believed it was trachoma. It actually changed what was done in Nepal and around the world.
In 1982, we who were in Canada wanted to start a Canadian organization in parallel in partnership with the Seva Foundation. We decided to start Seva Canada really to take advantage of opportunities in Canada from fundraising and government programs that would support what we were trying to do overseas. We were thinking about international programs and thinking, how can we get Canadian support for those international programs? The question about how does an organization become an organization that innovates is complex. There has to be such a selfless commitment to the goal that the obstacles to getting there are secondary.
You know for sure that Marty innovated because that was going to be better for people around the world.
When I started working with Seva, the standard of care in developing countries was to take the cataract out, which is taking the lens out of the eye, and replacing it with really thick glasses. Seva did a study early on showing that people who had cataract surgery within 2 years had lost or broken their glasses, so they're blind again. It was very important to have lens implants that the poor could afford. I was one of the ones pushing to manufacture them, and fortunately Aravind picked up the idea, and with a $50,000 grant from CEDA, the Canadian International Development Agency, a manufacturing facility was set up, and the price of lens implants came down from $300 to about $2.50, which meant that every poor person in the world could get an IOL. Seva is all about people. We approach the treatment of blindness, the curing of blindness, in communities. We don't just send people in to do surgery and leave. We empower communities to do the work themselves. It's really gratifying to see people picking up on new things and adapting them and helping more people see. One of the things that Seva is very good at is monitoring and evaluation, and we look at the results, we do surveys and get an idea of the quality of the work we do.
Well, research, monitoring, and evaluation is the core of what we do. It just involves them building their own capacity to keep track of what they're doing, and then to build their capacity to continually ask themselves whether what they're doing is the most effective use of limited resources.
There's a couple of things about what Seva has done that I'm most proud of. The first is that Seva has restored the sight of over 4 million people. That's an incredible accomplishment. One of the other things that I'm most proud of is the contributions that Seva Canada has made to ensure gender equity in the treatment of eye care.
The research that found that 2 out of 3 blind people in the world were women was done in the early 2000s here in Vancouver. What we did is we looked at population-based studies and disaggregated the data to see how many blind people are men and how many are women, and it turned out that everywhere we looked it was the same problem. 2 out of 3 blind people were women, and what we realized it was because of their lack of access to services. It wasn't because they had more blindness, and based on that we were able to start to change programs to emphasize women and their barriers and trying to overcome them. That then resulted in a dramatic change in how programs work, not just in Seva but in the rest of the world.
In Seva Canada's future, I see Seva becoming the acknowledged leader in gender equity in the treatment of blindness.
I would just say to the donors over these 35 years, thank you for your consistent commitment and trust. Seva continues to feel inspired by those small and large donations in order to do the best that we can.
What message do I have for our donors? It's very simple. Thank you. Thank you for believing in our work. Thank you for supporting our work. And thank you for trusting us to use your hard-earned money in the best possible way.
Thank you, Seva.
धन्यवाद
Thank you, Seva.